Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient being treated for low back pain with bilateral radiating thigh pain has been seen in physical therapy for 6 weeks. The patient notes a lack of improvement and feels her symptoms may be worsening. Which of the following new symptom complaints would be the most concerning? Option 1, sensory disturbance along the posterior thighs. Option 2, pain radiating to the thoracic spine. Option 3, inability to fully empty the bladder. Option 4, weight gain of 5% of body weight. As part of the examination for back pain, physical therapists should be screening the patient for serious spine conditions by identifying red flags. Red flags are signs and symptoms that may indicate a serious spine condition is present. Red flags should be used in combination with one another to determine the likelihood of a serious spine condition, since no singular red flag is indicative of serious pathology. Let's explore each of the options. Option 1, sensory disturbance along the posterior thighs. A sensory disturbance along the posterior thighs could be a symptom associated with low back pain. While it would be important to monitor the symptom, it alone would not result in an acute concern or the need for emergency referral. A new complaint of a sensory disturbance in the saddle region would be a more concerning symptom, since it is commonly associated with cauda equina syndrome, which is a serious spine condition that may require emergent referral. Option 2, pain radiating to the thoracic spine. Pain radiating to the thoracic spine is a symptom that may be reported as a patient's general low back pain worsens. Though this could be seen as a worsening of the patient's condition, it would not necessarily require emergent action by the therapist. Option 3, inability to fully empty the bladder. An inability to fully empty the bladder, that is to say, urinary retention, is a symptom commonly associated with cauda equina syndrome. Other red flags for cauda equina syndrome include new saddle anesthesia, new bowel bladder disturbance, new motor weakness, unilateral leg pain progressing to bilateral, and alternating leg pain. Though cauda equina syndrome is not fatal, it can signal a surgical emergency, since delayed intervention may limit long-term outcomes. Option 4, weight gain of 5% of body weight. Weight gain is not a symptom that is normally associated with serious spine conditions. However, unexplained weight loss should be considered, as it can signify the presence of spinal malignancy or a spinal infection. This symptom is considered to be a red flag if the patient has more than 5% weight loss over a 6-month period that is unexplained. The correct answer is option 3. Let's explore the all-student data. 15% of students selected option 1, sensory disturbance along the posterior thighs. 10% of students selected option 2, pain radiating to the thoracic spine. 60% of students selected option 3, inability to fully empty the bladder, the correct response. 15% of students selected option 4, weight gain of 5% of body weight. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is the foundations for evaluation, differential diagnosis, and prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out pages 304 and 374 in PT Exam A Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.